Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Burns, the causes and the depth. So here, first we are looking at the causes of burns. In causes of burns, there includes the scald. So what is scald? Scald is basically, it is superficial, as the name suggests. S for the superficial. So scald is nothing but superficial, but with a deep dermal patches. So it has deep dermal patches. So they have deep dermal patches in absence of good first aid. In absence of the good first aid, and will be deep in the young infant, and it will be deep. It is considered deep in the young infant. Now let's move on to the other varieties. That is the fat burns. So in terms of the fat burns, it involves a deep dermal. So it involves a deep dermal. And next is the flame burns. So in terms of flame burns, it is a mixed deep dermal and the full thickness. It is a mixed deep dermal and the full thickness. Next is the alkali burns. Alkali burns including the cement. So this is often the deep dermal or the full thickness. So it mainly occurs in the deep dermal. It is deep dermal as well as the full thickness. Next is we look at the acid burns. In acid burns, there are weak concentrations, that are superficial. So it is weak concentrations. It is superficial, as well as there is a strong concentration, deep dermal. Strong concentration, deep dermal. Lastly, we look at the electrical contact burn. So in terms of the electrical contact burn, it involves the full thickness. To learn and grow daily like this, please do subscribe.